The patient I'm thinking of is a very powerful example of how important it is to not give up. This is a woman who came to see us, and I believe that we were the 7th or 8th doctor she had seen, and despite the fact that she had been treated for so long, she still wasn't able to work. Within an hour or two every day, she literally couldn't keep her eyes open. Now, mind you, the 7 or 8 doctors she had seen previously didn't dismiss her. They didn't fail to treat her. They tried lots and lots of things that you and I would agree are really standard issue right down the middle of dry eye care. And yet, despite that, she still had symptoms which were rendering her nearly unemployable. What really made an impression on me, though, was the last visit she had, the last doctor she saw. She was sobbing as she was telling me that the doctor literally yelled at her. You know, I have dry eye, and I've had a significant dry eye since I was in my early 20s. Back in the day, though, there was very little that was available to treat that dry eye. So I saw this woman, I saw myself, I saw where I could have been had the diagnosis not been accurately made. And I felt so badly that she'd had such a terrible experience when the last doctor she saw was so close, was so very close to having a breakthrough. You know, the biggest takeaway for this for me is don't give up. When she came to see me, she was just totally defeated. She really had been so beaten down, and that last experience put her in a position of just despair. There were things that we were able to do diagnostically to show that she still had some dry eye symptoms that were treatable by treating the dry eye on the surface of the eye. We all felt so badly about her. It was thrilling to see her come back. And even though she wasn't cured, she was better enough that she came in that next day and she was absolutely thrilled that she was able to go to work. She was able to work a whole day. It took a lot of work on her part, but for us, the take home, for me, the take home is don't give up. Dry eye really affects your patients. There's almost always something else we can do. Don't give up.